Hi everyone, I'm Janice, a pharmacist from Kaisar Pharmacy, and today I'll be sharing to all of y'all about how to stay smoke-free for the sake of your children and the younger generation. First off, I'll be talking about the health effects of secondhand smoke. Secondhand smoke is a combination of the burning end of a cigarette and also the smoke that is breathed out by the smokers. Secondhand smoke contains more than 7,000 chemicals, hundreds in which are toxic and also more than 70% which often lead to cancer. There is no risk-free level of secondhand smoke. However, it can often result in more serious health problems, especially in infants and children, including a more frequent and severe asthma attacks, respiratory infections, ear infections, and also SIDS, which is also known as the sudden infant death syndrome. Smoking during pregnancy results in more than 1,000 of infant deaths annually. Some of the health conditions caused by second-hand smoke in adults may be a result of coronary heart disease, stroke, and also lung cancer. So next, I'll be talking about the three main effects of second-hand smoking. So firstly, I'll be going into depth of cardiovascular diseases. So exposure to second-hand smoke almost causes an immediate adverse effect to our cardiovascular health, in which it can often result in heart disease and stroke by almost 20 to 30% in most individuals. So breathing secondhand smoke often interferes with the normal function of our heart, blood and vascular system in ways that it can actually increase our chances of getting a heart attack. So in how to simplify the whole situation is that when we actually inhale secondary hand smoke, it can actually damage the lining of the blood vessels and also causing our blood platelets to become way stickier, hence making it much easier for us to develop a heart attack. Next, I'll be talking about SIDS. So SIDS is also known as the sudden infant death syndrome, so in which there is sudden, unexplained, unexpected death of an infant within the first year of life. So SIDS is the leading cause of death in healthy infants, but not many know it can often be caused by inhaling secondhand smoke. So the chemicals in secondhand smoke may affect the brain in ways that it actually interfere with the regulation of the infant's breathing. So infants who die from SIDS due to secondhand smoke often show higher levels of nicotine in their lungs and also higher level of cotinine, which is a biological marker for those who are exposed to secondhand smoking as well. So SIDS can also be caused by other reasons, but this can actually contribute in that factor as well. So how can secondhand smoke harm your children? Studies show that older children whose parents have the habit of smoking often are more prone to developing respiratory diseases such as bronchitis and pneumonia. They often have symptoms such as wheezing and coughing, hence resulting in childhood asthma as well. The chances of developing childhood asthma is about 40 to 50% more than any regular child who is not exposed to secondhand smoking. Another point not to forget is children who are exposed to secondhand smoke often have the risk of developing ear infections. They have fluids in their ears more often and have more operations to put in ear tubes for drainage. So next I'll be talking about how you can actually prevent or take safety measures in order to reduce the risk of your children being exposed to secondhand smoking. So first off, you do not let anyone to smoke anywhere near your home. So second, if anyone tends to smoke in a car, even with the windows down, try to avoid and also try not to be present in such situations. So make sure if you send your child to a daycare center or even the kindergarten, make sure they are not exposed to the caretaker or somebody in that area that actually smokes. If your state or your country allows you to smoke in public areas, look for restaurants or other places that do not allow smoking. No smoking sessions do protect you and your family to the dangers of secondhand smoke. So since I've already explained on how to avoid secondhand smoke, let's go into the core cause of the whole thing. So basically, if you have children at home and you're looking into ways of trying to stop smoking, look no further. You can come into any of our Kaisar Pharmacy outlets to actually get a detailed explanation and counseling on how and what are the steps that you can actually take further to stop smoking. So before going into detail, first I will be talking about what does an individual get from smoking tobacco. So basically, when you smoke tobacco, it's actually a form of physical addiction and a psychological habit. The nicotine from the cigarettes actually provide a temporary and addictive high or euphoria from inhaling the chemical. So because of the nicotine's feel-good sensation and its effect on our brain, you may turn to cigarettes for a quick and reliable way to boost your outlook, release stress and unwind. So the three main things that us healthcare professionals ask to a patient suffering from nicotine addiction is, if you are a heavy smoker, how much of cigarettes do you smoke a day? And are there certain activity, places or people you associate with that can actually influence your smoke cycle? Or do you reach for cigarettes when you're feeling stressed or down? So in that way, we can actually identify the degree of addiction that an individual is to nicotine. So how are we going to stop smoking? So basically, the first thing we can do is opt for nicotine replacement therapy, in which you can actually take a nicotine patch or also a nicotine gum in order to reduce the nicotine craving. So before we go to that part of the smoking cessation, first thing first, we have to be mentally prepared through the START plan. So the START plan has 5 steps, in which each alphabet of the word START actually stands for something. So the first alphabet, S, is to set a date, in which we have to be mentally prepared and motivated to embark on our nicotine-free life. So the second word, which is T, is to tell family, friends and co-workers of your plan of trying to quit. So in that way, you can actually find a quitting buddy, and the both of you can actually support each other to stop smoking. So the third alphabet is A. Anticipate and plan for the challenges you'll face while quitting. Of course, the journey won't be as smooth as you predicted. There will definitely be a few episodes of relapse. It's just that how motivated and how driven you are to actually stop smoking that matters at the end of the day. So what would you do if you have a nicotine withdrawal symptom or a cigarette craving? You can always opt for nicotine replacement therapy. So the fourth method is to remove cigarettes from or other tobacco products from your workplace, from your home, from your car, in order to prevent you from going back to that habit. So anything that smells like nicotine should be fully disposed of. The shampoo in your car, the clean, your drapes, carpet, everything should be clean, so that nothing can actually bring you back to that habit. So finally, you can talk to your doctor or pharmacist on how to actually stop smoking, in which I've mentioned earlier, you can opt for nicotine replacement therapy. There's definitely things containing nicotine that can actually help you reduce your withdrawal symptoms, and you can actually get many over-the-counter products in the pharmacy, including nicotine patch, lozenges that can actually help you prevent an episode of relapse. So the first NRRT is through a once-a-day way to beat nicotine cravings through the transdermal patch. It has controlled amounts of nicotine absorbed through your skin into your bloodstream. It doesn't interfere with your sleep, helps control your nicotine cravings for up to 16 hours, and it's available in multiple strengths in which we choose based on our nicotine dependence. So the next NRRT is to Nicorette gum, in which it's available in 2 strengths, 2 mg and 4 mg, and we pick based on our nicotine dependence. The nicotine absorbs in the lining of our mouth and provides a relief on our nicotine withdrawal symptoms. It's mint in flavor, and it's available in 10 pieces per pack. So that's all from us for today. I hope you find this video really beneficial and it has helped you in one way or another. For more information on how to prevent secondary hand smoking and also on how to improve your health or how to quit smoking, do not hesitate to walk into any of our Kaisar Pharmacy outlets. And do not forget to like and subscribe to our channel as well. Thank you and have a nice day.